A huge thanks to the Planning Committee and to all of you for the incredible sessions we've already had and the discussion that we're going to close out with. My name is Aliyah Bhatia. I'm the Acting Executive Director at Vote ER and Civic Health Month, and I'm honored to be here. And I was so grateful actually to Lorianne when I came to the prep session and discovered that everybody else was going to be in person, and I was like, I want to be part of the party too. Okay, I'm coming. So it's really, really wonderful to be here, and I want to start us with a story from December of 2019. I'm from Atlanta, Georgia, born and raised, and had the opportunity to go on a ride-along with a gentleman named Scott. Scott was the manager of an emergency medical service at Grady Hospital. Grady is our safety net hospital. And as part of the ride-along, Scott took me to a variety of different parts of town where ambulances and EMTs were connecting with families and communities in crisis. And as somebody who previously was an educator and who studied housing, what I saw did not surprise me. I saw families experiencing homelessness in the cold of December, reaching out for help from an ambulance. I saw families experiencing the health effects of dilapidated housing, needing help from a medical professional. I saw people who were having trouble accessing quality food, who were struggling and therefore needed help. None of that will come as a surprise to anyone in this room. It's what we've been talking about all day and what so many of you do day in and day out in your work. As I rode around the city with Scott, I kind of got to some of the questions Dr. Capel talked about earlier today, which is, okay, sometimes we want to do everything and we have to do as much as we can, but sometimes we have to start with what we think we can tackle. So I asked Scott, you have a magic wand. That magic wand can only do one thing. If you could raise your magic wand and wave it, what's the one thing that you would do? Scott's answer really surprised me. He said, I would have my patients vote. If all my patients voted, then the job services in the city would be well funded because local politicians would know who they were accountable to. The housing would be high quality yet affordable, and there'd be a grocery store in every neighborhood. And when a family finally needed my EMS for something that was actually a medical emergency, I would have the resources to get there in time. There are a couple things that Scott knew that I want to highlight here. And one of them is part of what brings us together today, which is that health is where all other social inequalities accumulate. When we talk about life expectancy, we're not just talking about a health issue. We're talking about social issues that have then accumulated into a health issue. And fortunately for everyone in this room, in addition to y'all knowing about it, this is actually something that lots and lots of Americans agree on. And in fact, it's the only issue where there is more than 50% of Americans aligned that health affordability and more broadly health policy consistently polls at over 50% of people realizing that it is a very big problem, and 86% of people combined saying it is a big or moderately big problem. So this is an area, the one area, where we have an opportunity for lots of people coming into agreement about the need to create change. And that's really, really valuable. And it says something really big about what everyone in this room can accomplish together. There's also a way in which Scott was a bit ahead of his time. The reason Scott's answer surprised me is that my prior work had been in education and housing, which we think of as social determinants of health, and I thought he was going to respond that we needed to fix one of those things. I thought he was going to pick one out of them. But instead he picked something else. He pointed upstream from the social determinants to structural determinants, to political determinants of health. And Daniel Dawes, who is a professor at the Morehouse School of Medicine's Satcher Health Leadership Institute, has written this incredible book called The Political Determinants of Health. And in it he states that voting is the most important of these political determinants. Why? Because voting is how we select the leaders who then choose the policies that make our country what it is, and that make, probably even more importantly, our neighborhoods and communities what they are through local and municipal elections. Now, there's somebody else important who realized this reality, and that was our founder, Dr. Alistair Martin. Dr. Martin was an ER doctor at Massachusetts General Hospital, and he saw patients day in and day out experiencing some of the similar things that Scott was seeing in Atlanta. Alistair was seeing people who were coming to his ER who could not afford food because they were trying to pay for their parents' medications. He saw people who had gotten just enough of a raise to be kicked off of the state health insurance system and then not be able to afford their insulin, and he wanted to do something about it. And Dr. Alistair Martin, therefore created Vote ER, which supports healthcare providers, hospitals, and clinics across the country to help ensure that their patients are registered to vote and can vote in upcoming elections. This is something that actually is done very frequently in other spaces. When you go to the DMV and you are getting your driver's license renewed, they are required to check in with you about your voter registration. And in fact, 45% of voter registrations happen in other types of public services like DMVs. So why health? Why did Scott make the observation he made? Why did Dr. Martin make the observation he made? We see the relationship between voting at health at 4 key levels: the global level, the national level, the local level, and the individual level. And when we think about that at Vote ER, we talk about this in our vision statement, that we believe healthy communities are ultimately powered by inclusive democracies. I want to go through each of these 4, and for our first one, I want to take you on a visit to Brazil. The reason I need to take you to Brazil is that, as many of you are very aware, in the US, every state has a different type of voting system. In fact, some counties have different types of voting systems. It is very hard to do causal relationship research around voting in the US as it relates to some of the very issues we care so much about. In Brazil, they had a fairly uniform national voting system, which lets us do some really interesting analysis. And I want you to take a look at the original way that people voted on the left. You would go in, there would be hundreds of candidates, and you had to remember how to write the name of the candidates that you wanted to vote for. Imagine if you were a less educated person, less literate person, and you were voting here. Countless ballots got tossed out. People came and they voted, they stated their voice wasn't counted. Well, Brazil decided, we're going to roll out electronic voting. And with electronic voting, there's a few things that you can see here. The first is, you can now see a photo of the person you're voting for. Before you hit go, you can actually look at that person, verify it's the person you meant to vote for, and hit go, and then your vote is tallied. The other thing you'll notice here is that they used numbers so that the barrier for literacy to be able to engage in the vote went down. It was much easier for someone who knew the number pad but didn't necessarily know how to spell out the names of their candidates to engage in the vote. There's just one issue with this rollout. Just like the US, Brazil has resource constraints. There was no way they could roll this out all in one election. So they do the very logical thing, and it turns out it helped us social scientists to look at it. They said, if you are a community with 40,000 people or more, you get this in the next election. If you're a community with 40,000 people or less, it's going to take a few elections for us to get to you, but we'll get to you eventually. This sets up an incredible opportunity to look at what happens when we have more accessible voting in some communities and less accessible voting in others, and a researcher decided to take a look at what happened. In those communities that were just above the 40,000 mark cutoff, there was 10% more votes that were counted as valid. Nothing else changed except the voting system, and 10% more votes were being counted. And with that 10% more votes came a 34% increase in public health spending, lower levels of low birth weight childbirth, higher levels of visits to pediatricians before giving birth, an incredible shift that then leveled out once you had everybody having the same voting system. This is a remarkable result because what it says is that part of solving the social determinants of health is ensuring that those who are experiencing the worst of those social determinants having a voice in their political system. That is one of the forces that we can use to create accountability around how our leaders respond to those social determinants. Now, I already gave you the warning that in the US, we can't quite do the same analysis because every state is different. But what we can do is estimate just about how challenging it is to vote in each state. And we can plot that against health outcomes. So if you take a look, you might have to squint a little bit to find Arizona on here, but if you take a look, this is the 50 states charted on voting access. and quality of health outcomes. You find Arizona about in the middle. This relationship, overall relationship, holds when you look at things like child mortality, infant mortality. And so we find that there is a relationship that we can assess between the cost of voting in a community and the level of its health outcomes. What I think is even more interesting, as somebody who's worked in school systems, is that you can figure this out in an even more precise way at the local level. Why is the local level interesting? More than 60% of local elections in America are nonpartisan elections. And most of the time, a change in the number of people voting doesn't change who wins. It just changes the number of people that person is therefore accountable to and who they view as their constituents, who they have to answer to in the next election. So local elections are a really fascinating way to look at this. A researcher at the University of California, San Diego, looked at exactly this question. And what he found was that who votes substantially impacts how governments raise and spend their money. Remember what we saw in Brazil, 34% increase in spending, right? When you only have wealthier, older homeowners voting, you see policies that cater to wealthier, older homeowners. But when instead you see an expanded population within a municipal election voting, the expanded turnout can increase the number of money going to redistributive programs by a third. Now, why do we care about redistributive programs? Well, this whole conference has been about how the social determinants of health may live outside the hospital, but still impact people's health outcomes. These are things like investments in health services, education, public housing, welfare, and the like, all contributing to the health outcomes that many of you see when you are in your hospitals and your medical spaces. And I want to be clear that this chart is not a causal chart. It's not as detailed and precise as you want it to be, and there are a lot of access issues baked into it. But I do think it's interesting that the relationship that we described a second ago holds right here in Arizona. That communities where there is higher turnout also have lower levels of social vulnerability and vice versa. And finally, there's the individual level. At an individual level, there is a two-way feedback loop between individuals voting and experiencing better health outcomes, one of which is the agency that comes with giving voice to what happens in your community, and the other of which is those better policies which then deliver to you that better health. So we see the relationship at the global, national, local, and individual level. Now, where you might be right now is, all right, Aaliyah, I buy it. There's a relationship between voting and health. It might even be causal. But why would you ask a patient about voting? Why in the world would you ask a person about voting in a health space? One of the things that Dr. Martin observed was that his patients deeply trusted him. And what he guessed was that if we did this in the right way, that the trust relationship between patients and healthcare providers would create a voice around voting that was very different from a TV commercial or very different from a person who's canvassing door to door or knocking on doors. And we believed that what we would see was that the trust in healthcare providers meant that people turned out and vote when they talked about it in healthcare spaces. Now, I mentioned before we have a complicated voting system here, and so it takes months for every one of those 50 states to submit their data so that you can actually check what you did. So I want to show you our 2020 results. Last year, we touched about 48,000 Americans with voting. Many of them were those who were less likely to be represented in voting pools, such as those being of color, and almost half of them, if not more, were categorized as young voters. We see generally that young folks don't vote, and so it's really important to have young folks vote. What we see here, though, was really incredible. What you're seeing here is turnout rates across different groups. You see it across racial groups, young voters, and unfortunately what the literature called low propensity voters. At VOTER, we call these high opportunity voters. But what you see here is that light blue is how many people in that category, or what turnout percentage in that category voted. The darker blue is if VOTER was the intervention that they had in 2020 before they voted. And you see that across racial groups, particularly among young voters, and particularly with low propensity voters, that people vote at a higher rate when the person telling them about the need to vote is their healthcare provider. And that's part of why we do this work, and it's why we need to scale this work and continue to grow it. Now, VoteR did not invent healthcare-based voter registration. In fact, yesterday I was at Mountain Park Health Center. They have for years been doing incredible work ensuring that their patients have access to the vote in really remarkable ways, really innovative ways. And I'm going to walk away from Arizona with many ideas of how we can do our work better. One of the best documented examples of this is Altamed. Altamed is a group of community health centers in Southern California. They have been involved in Get Out the Vote efforts for many years. And what they found in their work, when they had researchers look at the precincts that they worked in, predominantly Latino precincts, for every 1% of people who they touched, there was an 8% increase in turnout. That is astonishing, and it should tell us something about the importance of health and health providers and the health community being a part of voter access in the work that we do on a day-to-day basis. And fortunately, there are many organizations that already get this. Last year, over 700 hospital sites, clinics, associations, and 25,000 healthcare providers got involved in our work at VoteR, and countless more were doing this work already in their own way, through their local Secretary of State's office, through having voter registration drives in their space. So we just represent a small fraction of the work that's being done in this space. And a number of these organizations are right here in Arizona. ARMA, as a Civic Health Month partner, I know that we have Annabelle here, who was the former president of the National Association of Hispanic Nurses. There was also last year a really cool effort by Banner around Vote Like a Hero. So there are many efforts happening right here. What do we do specifically to help with healthcare-based voter access? The first tool that we offer is an individual tool, and I'm wearing it right here. It's a Healthy Democracy Kit, basically says, ready to vote. You can see it pretty far away. It prompts conversations with patients. And then when a patient asks, hey, why are you wearing that lanyard? Why does it say ready to vote on it? They can say, you know, I got to run, so I can't talk for too long, but I would like you to check your voter registration. Or I would like you to go ahead and apply for your mail-in ballot so that you can vote in a safe and healthy way in the 2020 election. And so that was how people used this last year, and we shipped about 25,000 of these Healthy Democracy Kits. The second way that people sort of engage in our work is institutionally. Hospitals will get engaged through posters that they put up in their waiting rooms. We tag these to the organization so they can see their data, right? We really love to see our own data, so we make it so that you can see on a dashboard how much your organization is doing. And then handouts for discharge paperwork. People are already getting lots of paperwork as they walk out the door. Let's add one additional reminder or nudge around voting. Other ways that organizations get involved in our work, we now have several pilots where people are asking at the registration desk, oh, I see that you moved recently. Have you updated your voter registration? Same thing that the DMV would ask you, just probably more frequently because it's in your hospital. And then we also have groups that join Civic Health Month, a national celebration in August around the link between voting and health. Finally, we engage with community health centers in a really interesting way. Many of you have probably gotten reminders from your clinics about upcoming appointments. And many community health centers already do blast texts around upcoming screenings, community programming that they're doing. And what we do is work with a behavioral design firm to craft really short voting reminders that can go out as part of that pattern or sequence of text messages. I want to say something that's a little bit scary, which is that, you know, we looked at those low propensity voters and we looked at, you know, young people, they're less likely to vote. There's unfortunately another low propensity voter. It turns out that physicians from 1996 to 2002 voted at about 9 percentage points less than the population. You'd think to yourself, all right, there were some very big policy questions around health. I'm sure we fixed this. You know, there were kind of major policies at the federal level around health. I'm sure people got involved in that. It has gotten worse. From 2006 to 2018, physicians voted at 14 percentage points than the general population. And so many organizations that we work with, the way they engage in this work is through this. They ask their employees to make sure they are ready to vote. Because every one of those employees, if you look at, I think, is it the Banner that says that they're the biggest employer in Arizona? Many of these health systems are enormous employers. They touch a tremendous number of people. And they want their patients' voices and their physicians' voices heard in the political process. How can you help? The first thing is, as you've seen from what I shared, it's not just the election for president that matters. It's the elections for dog catcher, it's the election for various commissioners. All of these elections impact things like the social determinants. So if you haven't recently, update and check your voter registration. You can do that in many places. One place is here at vote.health/33. Second, you can get a free Healthy Democracy Kit if you're a practicing provider, or even if you're not a practicing provider, you can still use the kit. You can order a kit at voter.org/kit. It takes about a month to get there. We've recently upgraded all of the online tools to be much more Spanish-friendly and much more easy to use, and so we're really excited about what we can do with those tools. The third is to ask your patients to check their voter registration. If you have a kit already, choose a day. Wednesday. On Wednesday, I'm going to ask my first 3 patients about voter registration. Then you're done. Make it a habit for you to ask one time a day, one time a week, to just check on your patients and help them make it a habit too. If you're an organization, feel free to join Civic Health Month. We have a number of Arizona organizations that have already joined. 240 organizations nationwide are a part of this community, and they're really all helping push the needle around making sure that their employees in the health space have their voices represented in policy. And lastly, we are always open to interesting sort of adventures with different organizations, customizing things to make it work for you. My email is there. I'm pretty easy to get hold of. Would love to set up time to understand what your organization needs and wants around this topic and how we can make that possible together. Before I open for Q&A and for next steps here, I want to take us back to Scott for a second, because there's something very important about Scott that I did not tell you. Scott is an older gentleman from a very white area of Atlanta. Scott took one look at me when I walked in, and he said, you leadership Atlanta people, you are so idealistic and young. Let me get rid of some of your idealism by taking you on this ride along. It was essentially how he saw and interacted with me. And over the course of our discussion, Scott tried to guess how I think about politics, and he shared how he thinks about politics. He wasn't exactly right about my politics, but he's probably right that we're a little bit different. Scott, before the pandemic, saw the relationship between the political determinants of health and voting. Scott, before the pandemic, knew that he wanted every one of his patients to vote like their health depends on it. And it's a really incredible testament to what each of you are seeing in the field and the importance of health equity work and the work that we can do if we both tackle each of those social determinants on their own merits, but also bind together around making sure all the voices of our patients are heard. Thank you.